Well, welcome everybody to the Finance and Planning Committee meeting of today, and we'll ask the secretary to call the roll.
Yes, I'll start with you, Commissioner Chow,
Present?
Vice President Guillermo,
Present.
and Commissioner Dorado.
Present.
Thank you. I'll read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, the approval of the minutes of the Health Commission Finance and Planning Committee meeting of July 7th.
The commissioners, the minutes are before us for approval. Is there a motion?
I'll move approval.
Is there a second?
Second.
And is there any public comment in the room on the minutes? I would like to note that Commissioner Chow asked me to correct a sentence before you approve on page 3, under item 5, the request for 25 new Chapter 6 contracts. It's the last paragraph, the last sentence. This is how the sentence should read, and we'll read in the final version. The relationships with these vendors enable them to already know the various DPS campuses and DPH general service needs. And then all those in favor?
Aye.
Aye.
All right, thank you. We can move on to item 2, which is the monthly the monthly contracts report.
Good afternoon, Commissioners. I'm Kim Baker. I am the Director of the Office of Contract Management and Compliance for DPH, and I'm going to be going over the monthly contract report for you today. And the monthly contracts are just basically extensions and amendments or continuing services for contracts that we've already brought forward in the past. And that's why they're included on this monthly report. We have 8 of them for you this afternoon. And then there are 4 new contracts that will be presented by the actual business owners of those particular contracts following the monthly report. So the first item that we have, let me back up just a minute before I get into the items. It reminds you of something else that we talked about last time I was here. We do have this admin code 21.42, which I'm sure you're familiar, is basically our sole source admin code that allows us to continue particular contracts so that there's no gap in service until we can get a new contract in place or a new solicitation done. The attorney has been working with us very carefully on how to best interpret that code and make sure that we're being as transparent as possible. So we owe you a presentation and a new procedure on how we're going to do the 2142 contracts going forward. But until we get to that new procedure, I have 3 of them on the list today, and I'm going to call them out very specifically so that you're very much aware that they fall under the 2142 regulations, okay? So that it's just real clear. And then there'll be a presentation in the future that will go into depth on how this procedure is going to work going forward.
And if I may, Commissioners, I'll be working with Kim and the Finance and Planning and the City Attorney to make sure that the Health Commission is represented in that new process, and I'll be letting you know what we're finding before it comes to you officially.
All right, thank you. So the very first one on the list is a 2142 contract. And so this particular contract is with Health Right 360. The contract is for the San Francisco Street Violence Intervention and Prevention Program. This is a 6-month extension to the contract for $3.4 million. And we project to spend about $2.4 million of that over the next 6 months. The reason for the difference in the number is that there's $1 million in contingency. That's why you see the $1 million difference in that little 6-month period of time. So this contract is for a bereavement fund and life coach program for at-risk youth. And what's happening with this contract is it's transitioning to a new department. So that new department's going to do their own, we may help them. We haven't decided yet, but there's going to be a new solicitation done. And then there will be a new contract to continue the services. But although it's going to a new department, we're still going to fund the bereavement fund that services part of this mission. So DPH will continue to do that. It is a cost reimbursable contract, and it's funded out of the general fund. So are there any questions about this particular contract?
Commissioner's question, Commissioner Guillermo.
Thank you. You actually answered my question about the difference in the amounts. My question
Yes.
was that with or without the contingency? So that definitely, thank you for that clarification. Just wondering, why is it going to a different department?
I think they've decided that it's better served in a different department because of what the scope entails. And so I think there's been some internal conversations about moving it. And then, like I say, with DPH still funding the bereavement portion of it.
So if funds are being expended out of the DPH budget, we won't have any oversight because the contract is technically under a different department?
We'll have oversight just on the bereavement fund part of it, from what I understand. And I'll ask Navina if I've gotten any of this incorrect to help me.
To clarify, so we will have oversight for the 6 months until the contract ends. It is planned to either get probably re-RFP'd out and under a new department. So they will oversee the contract from there forward.
Even the bereavement fund?
No, the bereavement fund will stay with us and we will oversee the bereavement part.
Okay, so will that be the administrator or will that be BOCC?
It will be the
Bereavement fund?
administrator.
Okay.
Yeah.
All right. Thank you.
Any other questions?
Just have a question.
Sure.
With the,
I got it.
there it's on, okay. What are some of the sites of the prevention program? Where exactly is the outreach, especially when I'm looking at 10-year-olds in the
Okay,
program?
thank you, Navina. I know it's at risk.
Okay, yes, there's 3 major places that they're at, actually 4, I should say. 3 include Bayview, the Tenderloin and Mission, but they're at most of the schools as well. But in terms of like community outreach, those are kind of.
Right, those would be the 4 areas. But generally, is it like Boys and Girls Club, or is it specifically more at the schools?
It's
And
at the schools.
so they go into both middle schools and high schools?
Yes, that is
Both?
correct. At this point in time, yes.
Okay,
And then because schools also have interrupters on site, so they partner with them as well. So things that are happening in the community, they can bring that knowledge into the schools and work on issues within the school as well.
do they then give you, let's say, as part of the reporting, a list of what schools or where exactly they are?
They can provide a list of the schools that they go into, yes.
Okay.
Yep.
Thank you.
Commissioner, would you like to get a list of the schools or just know that there is a list?
Well, because I'd like a list of the schools just because the complexion, schools change every year. I mean, so to speak. And there are some that I know of that are much more high need, let's say, than others. And so I just wanted to see what the list is. Would be great.
Okay, thank you. Let's go on to the next one.
Okay. All right. So the second one is for Centerpoint. This is a residential treatment program. So this amendment is a 2-year extension for $1.7 million or about $837,000 per year. There's really no change in the annual funding for this particular contract. What this contract does is it provides overflow beds in San Rafael for men, women, and children in the event that there are no beds available in San Francisco. They have a total of 8 residential beds available for our use, for our needs. And this particular contract is authorized by the city's bed ordinance, and it is funded by the general fund. And I know you guys had some questions about patients placed, and we provided that information a little bit earlier. So hopefully that answered your question.
Yeah, questions, commissioners? No questions. Thank you.
Okay.
We'll go on to the next one, please.
Okay, so the third contract that we have for you is Agent Pacific Islander doing business as San Francisco Community Health Center. This is a 3-year extension for 4.2 million or 1.2 million annually. There's a very slight 1.4% increase, and this is basically just a cost of doing business increase, nothing substantial there. This amendment continues a drop-in service center providing hospitality, case management, recovery, linkage, and navigation services for people experiencing homelessness and who use drugs to connect to treatment. This contract is funded 85% general fund and 15% federal grant. Any questions about this particular contract?
Commissioners? Questions on?
The questions about the monitoring were answered, I guess, in the.
In the question?
Yeah.
Yes.
Actually, this is a agency that we've contracted with for quite a while.
Mhm.
So I don't know if there's a sort of a question about, since they are very familiar with DPH's monitoring, just why the, I guess, the delay in the audit, if they kind of know what the schedule is,
Right.
what's expected. Is there anything there that's different this time around versus in the past? Or besides there was changing in staff, but that's still.
Right.
Like-
I'm not certain. Let me see if maybe Michelle can provide some guidance on that.
Hi, good afternoon. Michelle Ruggles. I checked in with our manager from the Business Office of Contract Compliance that does those audits, and he didn't have anything more to add to that blurb. So I think what they're continuing to do is just to monitor them. I'm not aware that anything changed. I think their timing has been improving. Still not great. They still missed that deadline, but I think it's because of all the other indicators, of which there's many, that get checked annually with the citywide fiscal and compliance team. And so they're watching the trends. So at this point, they haven't, because everything else is strong, it hasn't risen to the occasion where they have ratcheted up the next tier of involvement with the city process. And that can go, up all the way to being defunded. So they haven't reached that point. And the team of city departments that contract with them and the controller are still watching them because of that, but still involved, but still feel comfortable because their finances are strong to recommend them as okay.
Wondering, because they've been getting more funding from DPH or more contracts, that might sort of stress, the capacity that they have on the fiscal side. So it'd be, I'm assuming you're monitoring that, or I don't know if that's.
Always a consideration, right? Like someone's good, so they were flooded with money and it puts a burden on them. I think, I don't know why they're late. I know that it is hard in the financial world. There's been a lot of changes that we've seen. I don't think any of their other indicators are indicating stress, which is why they're still comfortable moving ahead. They check a lot of items, which if you ask me, I'll forget what they are, but they check a lot of, like the board, and they go to did the board present the findings? So they actually make them show that they presented to the board, their own board, how they are doing. So I don't think that's the case, but it's certainly something that the department will continue to monitor with the rest of the city.
Great. Yeah, just they're a valuable resource in the community, so want to make sure that they're being supported. Yeah.
Yeah, thanks.
Oh, I see from your comments that we received back to some questions in regards to that contract. I think it would be good that we get a follow-up in terms of the performance audit. And I think it'd be important for the agency to realize that we are not really pleased with the fact that they've been told that audits need to be timely. And there's really no reason, regardless of changes of staff and so forth, that they do not follow this. I mean, we're pleased that they're financially okay, but that's not a reason not to be in compliance with timeliness. I mean, we all have to file something on a timely basis, and so that shouldn't be foreign to them. And if they think that this is just one area that for several years, we've gone by anyway and get around to do it, one day it may not really be a good time for them to do that.
Right.
So if you'd come back with what the follow-up is, and also that the commission is really needing to know that they're going to really be in compliance with timeliness.
Got it. We'll do that.
Okay.
Actually, I'd like to step back for a second. Commissioner and maybe Michelle and Kim, what are you looking for with the follow-up? Just a verbal report back that they've checked and communicated that, or is there something specific? I want to make sure that they are honoring your.
Well, I like their statement they gave us. The department will be happy to provide the two reports, which is the performance report and performance monitoring review, upon final completion, and discuss any individual categories that require follow-up.
Okay.
Okay. We can
So-
Is that good? Okay,
Mhm.
thank you. I just want to make
Thank
sure
you,
that.
Mark.
No,
Clarify.
I'm just going by what they've offered.
Yes.
And I think we should accept that.
Okay.
Thank you. Let's go on to the next one then.
Okay, so number 4 is the Gubbio project, and this particular contract is a 2-year extension. It does have changes in scope and funding. This is a $7.8 million contract, spending 2.9 per year. There's $1 million in contingencies, so that's why you see a little difference in the numbers there. It's an increase of just a little over $500,000 or 22%. And that increase is for added staff at the sleep site and expanded ambassador services for the street program. So there are 2 programs, as mentioned, in this particular contract. The Mission Safe Sleep Site, which is 45 beds for daytime respite care. And the second program is the Street Ambassador Service, which is street cleaning and health promotion in the street. This is a cost reimbursable contract that's moving to fee-for-service next year. It's paid for through 90% opioid settlement and 10% general fund. And just a general note on this one also, this will require Board of Supervisors approval. So we'll be working to get it to the Board of Supervisors as well. Any questions on this one?
Commissioners, questions? I appreciate the explanation you gave us. And it says that the agency or the project, so is it a project or is it, well, it's actually a 501c3. So just trying to remember, if it was formed in 2004, I guess we're all trying to remember what they've been doing with us. Or is this the only project they actually have with the department?
I'm not certain about that. Do you know, Michelle? Or Robertson, maybe? Robertson?
Historically, I believe, and they were in St. Boniface Church. And then it moved as well, but that's where they started for a number of years.
So I have a little bit of knowledge about the Gubbio
Please
project.
always introduce yourself and your title.
Yes, thank you
Yeah.
for the reminder. My name is Robertson Somoa. I'm a contract manager for DPH for the Office of Overdose Prevention, and I manage the Gubbio project contract. It's a brand new contract with the city, and this is the first time that we are funding them. We started last year, and this is basically expanded services that we are paying for.
And so I guess Commissioner Guerrero can tell us more about that. Were they formed by the church and then went on to
Yeah.
then St. John the Evangelist, or
I don't have all the background knowledge of
yeah.
that. Yeah.
Correct.
I think she-
Okay.
It was founded initially by the Franciscans who have St. Boniface Parish because of it a number of years ago, because of the increase in the homeless folks sleeping on the sidewalks, et cetera. And so they opened the church at night or from 8 to 8 or something similar to that. And and they slept in the pews. And so they were out of the elements, and then also provided some food and whatever. And then that was for a number of years. And one of it was not only because of the number of folks sleeping on the street, but next door is Tamariac Academy, which is a 4th through 8th elementary school. So it was also part of taking care of the folks, but keeping the neighborhood safe so the kids could walk into school. So it went for a number of years and then moved to St. John's, and then I guess became a 501c3. That's what I,
Thank you for that history.
yeah, that's
that's wonderful. Thank you. Well,
I know, yes.
So just to clarify, so the Gubbio project, though, it was newly, because the gentleman said it was a totally new contract, but that was last year,
Yeah,
right?
This is an extension.
2024.
So this year you're just adding to,
That's right. We're just doing an
Services.
extension to it.
and that didn't require a solicitation or a,
It did not. It's the same services. We're just extending and doing a little bit of increase in funding to the two programs.
thank you.
Anything else? Or are we ready to move on?
I think it's okay to move on.
So I guess as a new program, we really don't have performance yet on them. Or do we?
I'm sorry, I have a little.
I mean,
Standards, is that what you were saying?
No, just
well, I'm wondering why we decided that now. I mean, we gave apparently a 1 year, and then now we're asking for a 2-year extension. So what's the criteria of them having decided? And I'm assuming that the contract itself allowed for the extension.
Yes, the contracts can always be extended. We work through our legal department if there's any, gray area on the contract. So we are allowed to extend it, and that they must be doing well. And so there is a need to go ahead and do the increase now.
Okay.
Yes.
My other question would be, so they have been, they've had this contract for a year
Mhm.
since July of 24. Is there performance data? I know it says it's coming, but there should be performance data for the first year of how many people how many people were served and things like that.
My name is Robertson. Introducing myself again, I'm the contract manager for the Gubbio project. We've been collecting data on a monthly basis about the number of people who are sleeping during the day, the people being connected to services on a regular resource and navigation, all that. I don't have the numbers with me right now because I didn't know I was presenting on it, but we can provide that information to you as soon as possible. Yes,
I'd
we
be
have it
interested to
available. Yeah.
see, since they have taken the project over like 6 years ago and have, you want the extension of the funding, et cetera. I guess I'm just a data nut, but I like to see particularly how many people the programs
Yeah,
are serving.
And please send
be
that to me
great.
and I can get that to the
absolutely.
commissioner.
Will do. Thank
Yes,
you.
and commissioners, my, total anecdotal observation from being in the hallways is that this is seen as a shining star,
It is.
And so it's all anecdotal that I'm just hearing that obviously they're doing well, both on the paradigm as well as the actual performance, but I'm sure we'll get the data.
Well, and I'd be most interested in how the numbers they're expanding for the street ambassadors too, with funding, because the street ambassadors are essential. So,
Very
I mean,
important.
it's,
Yes. Making a big difference in our community, right?
yeah, definitely. So I just think, I mean, as health commissioners and people are asking us, I'd like to be able to say something other than, yeah, they're doing okay, but yeah, they've served, over X number of people.
More specific information to
Just,
share.
just a
Yeah,
few specifics, yeah, would
we
be
can do
great.
that. Okay, ready to move on?
Well,
Yep.
I just would like to follow up just a moment too on this because the deliverables are very extensive. And I guess I didn't actually ask about the numbers as I usually do because I had thought that they were at that point in a cost reimbursement process. And now you're moving them to a fee for service and we're also moving them to 2 years. So there must have been some sort of information concerning the history of what they were doing. And I'm just sorry we don't have it because it sounds like it's really an important project and there's really a number of specific things and you're telling us there are, 45 beds or so that's available as part of the program. And Commissioner Gallardo has given us good background on who they are.
Mhm.
So I think that's just piqued our interest. So if there's anything you really do have about that last year that gives you confidence, because there must be confidence that you're moving to a fee-for-service model, that it's not just cost reimbursement, which we often use in order
Right.
to make sure that we can get it going, right, and get it covered.
Yes.
It would be really nice to have as
Robertson,
background.
excuse
Right.
me, is it, you don't have to stand, it's okay. Is it logistically possible to send me any of that data before 4 o'clock or before 5? All right, just email me and then I can pass it on to the commissioner. So at least you can get something today
Good.
before you vote. All right, thank you.
No, it sounds very worthwhile.
It is.
And I think, and now we've learned a great deal about them and really commend them for the work they're doing, I think,
Right.
and we can then move on.
Okay, great. Okay, so the next item is with KPMG. And this is a 3-year extension to a contract. We have with KPMG. It's a $2 million extension or 1.3 annually. Now, let me work the math for you because the math is a little bit wonky here. If you take it's a 3-year extension, as I mentioned. So if you take 1.3 times 3, obviously you're going to get more than 2. So the reason why the numbers are the way they are, the reason why they're only asking for 2 million is the 1.3 is an average spend over the course of the contract. This is an as needed contract and it provides IT support for the San Francisco Health Plan to transition information over into Epic. So they have a big project coming up this next year to continue to move substance use information over into Epic. So it'll ramp up, they have a project to do, and then it's going to taper way off for the next couple of years. So it's really just as needed services for the IT department to accomplish these tasks to get information into Epic. It's funded through the ERH Continuing Fund and various grants, including one from the health plan to make this happen. And that's all I have for this particular contract.
So you're saying that this is directly, actually, it's interesting because in your comment for the funding change, it's because of the San Francisco Health Plan IPP grant. But now, from what you're reading, the grant itself is not enough money. That's what you're saying.
they
And
pull
therefore,
money-
there's,
Yeah, they pull money in from various grants and sources to fund this contract based on the projects that they're working on at the time. Think of this as really like staff augmentation for IT. So IT, wouldn't be prudent for them to have permanent staff because these are just for peak projects that they have. So these people can come in, assist the IT department with those projects. Once the project is finished, they go away. And we don't have long-term costs associated with those staff. He has a whole pool of these types of contractors. This is just one of them in the pool.
so if this was a contract that began in 2022, what is the anticipated time to transfer the behavioral health data programs into Epic?
It sounded
And
like,
is this being managed by our IT people that is managing Epic?
it is exactly managed by our IT people. And it sounded like from talking to them that they expect that to happen this next year. That is the big focus for this next year and why he's asking for this additional money. I think he said this is about $2.5 million project. He has funds left in the existing contract, but he knows he's going to need more to get through this last big push to get this data into Epic. So that's why you see this request here for you, before you today.
And that big push would give us the coordination or integration into Epic at what point in time?
That's probably a Jeff Scarafia question. So if he's online, maybe he can take that.
I am. Kim, you're doing a great job summarizing all of those. Good morning, good afternoon, Commissioner Chow. Roughly the beginning of June. We did our Big Bang Epic Go Live back in 2019. We've rolled out many additional clinics. 2024 was mental health. We are now bringing substance use services and are targeting the end of May, beginning of June 2026. So the project to move the data, prepare, train staff, etc., all of that will be complete prior to the end of this fiscal year.
Oh, very good. Thank you. Commissioners, other questions?
I have a question about the substance abuse data in Epic. Is that, I thought that had to be somewhat protected in some way, or is that incorrect?
42 CFR Part 2. I'm not sure we'll have enough to dive into the overall topic, but to say that that's very much on our radar and a core part of the project work that we will be doing. You are absolutely right. It's definitely on our radar, and we are working with Office of Compliance and Privacy and the substance use subject matter experts to ensure that we account for that during this effort.
Well, is there a current plan that, I mean, I'm sorry, I'm taking your next step, but so is there a plan at all to put that data in Epic, Jeff? Or is that something that's still being worked out, whether that's going to be able to be done?
Yes, it will be in Epic. We've already worked through a lot of it with compliance and privacy regarding reformatting some of our consents. There were changes to 42 CFR Part 2 in the federal legislation last year that allow for some of that. Again, I'm a little hesitant to just really dive into the details because it is such an in-depth topic that I'm not sure I can cover it briefly. It is part of the project. The data is coming into Epic. There are protections for it. And again, that is essentially the core tenet that we are working around as we do this particular implementation.
Thank you. And commissioners, I can ask for an update, the full commission, when it sounds like it's still kind of cooking,
Okay.
when it's ready.
I'm wondering, because I thought it was like the old kind of with some of the behavioral health data, but I thought it was substance abuse. Like in order to access that data, it was like a break the glass or something in Epic. So that's where I'm wondering, because I know from previous IT discussions, it had to be separated out somewhat, or it was not going to be accessible to one and all on Epic. So yeah, more information I think would be helpful.
Was nice to know we have a contract continuing the project and that there is an anticipated end to it in 2026. So, but we will not hold you to that because we understand the problems of working through all this combination. Matter of fact, just to even hear that we're getting to combine them into a single
Yeah.
database is really important. And so is your work. Thanks. Commissioner Guillaume.
So your response prompted another question. So if this is sort of the anticipated key project that's going to be happening over the next year, the contract goes to 2028. Are there other key projects that are anticipated from this funding?
Yes, but not that need increase in their not to exceed amounts. So those contracts are already in place and do not need to go through your commission again. In a nutshell, we do have multiple contracts that fit into this category of sort of that ad hoc support to do projects. When we bring on a contractor for sort of say 6 months to a year, those are running within their existing budgets to do. We used them for mental health, and we did not. Essentially, we didn't use all of them when we did mental health, so some of them have remaining budget. We'll be using the existing contract.
Okay.
Thank you.
Thank you. We'll move on to our next contract.
Great. So the next contract is the Regents of the University of California, UCSF. This is continuing services in a new 5-year contract for $7.9 million or $1.3 million annually. It's slightly less than 1% increase from the previous contract that was approved by the commission in 2022. This UCSF Alliance Health Project, AHP, provides health services for patients with AIDS, HIV, and serves the LGBTQ community along with all citizens in San Francisco, and also provides psychiatric consultation for our gender health clinic. It is a 50% Medi-Cal, 50% general fund fee for service contract. Any questions?
Questions? Yes, Commissioner Guerrero.
I do. When we say Medi-Cal with a fee for service, is this an exception then for the Regents or for UCSF? Since for behavioral health, they do not accept Medi-Cal. So is this something that's specific to this project, or that's because otherwise they don't accept Medi-Cal?
Right. Let me ask Michelle to answer that question.
See that? Yeah. Actually, they all our UC contracts with behavioral health do accept Medi-Cal. They're it's short Doyle Medi-Cal, the carve out for specialty mental health, or I guess organized delivery system for substance abuse. But so it's common to have 50% federal financial participation matched by 50% of general fund or a non-grant, non-federal funding source can serve as the match.
Okay, I just need to further understand, I mean, because I'm kind of new on this committee, but if I have a Medi-Cal patient and I am referring this adolescent to UCSF, to psychiatry, they will not accept this patient because they are Medi-Cal. So this is where I'm trying to understand, is it different for these particular grant-funded projects versus the general public when they go to UCSF, because it's very specific.
Right. So I can't speak to their very specific programs, but I can tell you that through behavioral health services, they have to enter into a contract with the Department of Public Health. And so that could be really different. That could be their own health plan. So they have to enter into a contract with us to draw down Short Doyle Medi-Cal because we're the provider or the authority has been delegated to the Department of Public Health. So if you are referring them to a DPH contract, then I would be pretty assured 99% that there was Medi-Cal involved. So I think maybe what you're referring to is referring a client to as an individual is a UCSF specific program that's not a contract with the Department of Public Health.
Okay, that's what I'm asking, and I think
Yeah.
you've clarified it. So, for example, my other question had been, which is, this is all in the same, so I'm going to ask at the same time. On the annual performance monitoring is where I got the UCSF Child and Adult Services at the Pritzker Psychiatry Center. It's a new contract. I mean, I'd love information on that, but again, whomever the child and adolescents, if they are being served by this particular contract, whatever that might be, and I'd love to know what that contract is, then it's Medi-Cal?
So I don't know without, it should say, is that in here?
Mark, that's
That
what my
contract.
question was from.
This one. So I think it's something we'd have to check 100% specifically. Did we pull that? I'm not sure why that's on the list of the contract. That's part of the confusion, but I'll say, I don't know off the top of my head if that program is Medi-Cal eligible. I think that was the goal. And if it's not Medi-Cal eligible, then it wouldn't work. Like you couldn't refer in. I know when we set up this contract, we wanted to have access to their specialty services. We can check and find out if it's
Okay, that'd
Medi-Cal
be great.
eligible. But first they have to a new program has to get Medi-Cal certified, and we do that with them through the state. And only then are they able to seek Medi-Cal reimbursement for the services that are Medi-Cal eligible, but definitely can confirm. Since it's not on here, I can't check.
That'd be great. I'd really appreciate the information about that program.
Sure. But again, it sounds like it was a clerical error that's on there even, right? Because that
I
contract.
think
isn't
it was a
in the-
clerical error that it was on there.
Okay.
Because
Yeah,
the contract's not on the,
Right. It just says.
sometime, yeah.
I think that was on an earlier, it was on the agenda at one point in time and it moved, and it probably just never got picked up.
Oh, yeah, there's no problem with it. I mean, I'm just trying to make sure that Commissioner
No,
Toronto knows
I-
that there's
I
not a
just-
contract matching that particular.
I do a lot of referrals, so
So you want to know?
put it that way. And
Yeah.
I work a lot with their programs. And so the more I know,
Yeah.
the better off I am. So, and
To
for example-
clarify, that is not on the contract, right?
Correct.
Right.
You are
Right.
correct. It
It
is
just
not.
happens to appear. That's why we can't find it.
That's why- that's where I was going. But
Is it okay to move on then, Commissioners?
sure.
Sure, that's interesting. That it is on here and it's a new contract.
Right.
and we're
Well,
all-
Well, again,
So-
it all.
You'll get information for Commissioner
Yes.
Gerardo on this. Thank
For
you.
all of us, right?
Oh, yes, but
Okay,
I want to make sure you get it.
Yeah, I do. Yeah.
so the next contract that we're going to talk about, this is number 7. This is another 2142 contract. This is the Public Health Foundation Enterprises doing business as Haluna Health. This is an amendment for 1 year for $271,000 or $242,000 annually. This is program management services, implementing priority mental health initiatives for SB 43 and 5150 reform efforts for systematic improvements to the mental health response. This is, again, authorized under 2142 is a sole source waiver amendment, and it's funded by the general fund. Any questions?
What type of consulting is actually being done on this? I mean, this is sort of a wide open contract, so.
Right. It looks
What has been done in the past?
in the
and
past.
What can be anticipated?
Okay, we're probably going to need to ask Christine Wright. If she's available to respond to that.
Hi, I'm Chris Wright. I'm Director of Civil Court Programs for DPH.
Could you please speak up substantially or get closer to your microphone so we can
Oh,
hear you?
sorry.
That's better. Thank you.
Sorry, my computer's old. So my name is Christine Wright. I'm the Director of Civil Court Programs for DPH. And so things that this contract has done in the past is supported the launch of Care Court, a lot of work on the implementation of Senate Bill 43, which expanded grave disability as it applies to both involuntary psychiatric holds as well as conservatorship. 929, which is state data reporting on 5150s. They've done a lot of work to kind of operationalize some changes in that. Supporting SB 2242, which is the model care coordination, ensuring that everyone who experiences a psychiatric emergency and goes to the hospital leaves with a care plan. And then currently we're working a lot on our designated facility agreements and MOUs with the hospitals, which haven't been updated since 1996. So you can imagine there's a lot of work to do there. And then just helping out with any changes in legislation as in these higher level, more acute systems of care.
So, I mean, Helena Health does a lot of things. Normally, when we've seen consultations, they actually are with groups or people, or just like, consulting firms that specialize in that particular project or that particular skill. So being that Helena Health is such a wide-ranging organization with many types of services, what type of expertise do they actually bring to do this? Because Ms. Wright has just described that it looks like it's all over the map. And so we're looking for consultants to help us. How do they find those consultants, and why don't we have them in the department?
That's a good question, and probably beyond something that I can answer. Christine, I don't know if you have any insight into that.
Well, I can't speak for all of Helena Health. We work with one contractor, and I know her very well. And she actually did used to work for the mayor's office, so she has a lot of knowledge of San Francisco, like how legislation moves through, how to support us in these implementations specific to San Francisco. She's got a lot of expertise in policy changes, which is a lot of the work that we're doing. And so Star she's very knowledgeable. She's our subject matter expert in all of this.
So you're actually dealing with one person?
Yep. Yep, Star.
Michelle Ruggles, I just wanted to add, so typically we go out to bid when we have time, but for an RFP for program administration. So that's the primary service that a vendor provides, is the program administration in this type of contracting model. So it means they're helping us to implement, usually it's a project. Sometimes they're helping, it depends on what the project is. But anyway, we'll get a list or a request for qualifications of program administrator vendors. And then that will be followed by an RFQ by an individual contract selection for the vendor to do the project. But in general, what the program administrator is providing is not necessarily the expertise in the subject, but the expertise in helping us to get our services out. So they're like experts in the invoicing. They have cash flow. They also, we've used them, and you might like with sugary drinks, they'll put out do like where we can't, or in the past haven't been able to enter into agreements with the neighborhood-based, very small, maybe not 501c3 vendors, but that are the entities that are on the ground and close to the people that we're trying to reach and serve, like in churches or whatnot. So they'll help us with that. Sometimes through that, these are like usually grant-funded projects often. They'll help with they might have an evaluator that they'll go out to bid for to get an evaluation and then collect the data, which I think is exactly the case with the sugary drink tax. This was an emerging issue, and so they looked for individuals that would have expertise in the areas that we needed the support with. And so in the last, but so they'll hire consultants sometimes in the past, like during COVID, they hired employees, they hired consultants. So they have the HR background and the fiscal. We don't use it as much anymore, but we do use it to support DPH projects where it's not conducive, timing or other reasons or specific criteria to, like, if it's long-term, we're trying to hire civil service staff, actually not go through a program administration contract. So that's generically how we use them.
Okay. No, thank you. That's helpful.
So just to clarify, so in this instance, for this 1-year contract, it is because Haluna Health had a staff person who had expertise in the area where we don't have it. So, because it looks like it's mostly policy
They hired a
consultation.
consultant, and I
Yeah.
think when it first started, it was very specific to X, and now X has morphed into Y, and so they're retaining the same consultant to continue for another year, I guess, to complete the next part of this phase of the projects.
Okay. Just sort of just thinking about sort of the future for these types of program administration needs, whether sort of efficiently or effectively doing things like this in-house versus a contract, or it's just being examined, in terms of,
Yeah, actually,
what's-
that's the direction of the department, is to bring as much as possible in-house. Like historically, when projects would start, there'd be like when when managed care started in behavioral health, it was all set up with contracted employees who are now all civil service. So more and more, we have a lot more options, or we know about a lot more options today than we did. So there's possibilities of hiring like it's called a category 18. I don't even know what the category of, but it allows you to hire a civil service position for a project that's short term, like up to 3 years. So that didn't exist. So there wasn't really a way to start new projects. So we'd start the new projects, and then over the last 10 years really have been evaluating the programs to see what the programs are, and can it come in-house, or in some cases, should it be contracted out as a standalone 501c3, which I think is what may happen with the violence intervention program, that the first contract, when it leaves DPH, it will go out of this model and into I think that they'll bid it out, whatever department, probably. They'll either bring it in internally or they'll bid it out as a 501c3. So yeah, that is the department's direction. There's also just a lot more flexibility, and I don't know if that's the right word, but just like ability to, like things you couldn't do, like buying gift cards or things that are part of a program model, were really, really, really hard in civil service. And there's been enormous strides to set up procedures, standards, automate, that you can do things that were not very easy to do just to get business, keep business running,
Mhm.
get, client shoes if they ran out or wraparound services. So yes, you called it, when we are trying to bring stuff in-house whenever we can.
Appreciate that. Thank you.
Yes, Commissioner Carroll?
I have, excuse me, just one other question. When they provide, the information and the support, et cetera, and the improvements in mental health response, coordination, et cetera, and hospital agreements, is there someone within our department or that works with STAR, whatever, clinically, that, let's say, says, for example, I guess in some of these contracts, there isn't often the clinical input, for example, with, as you mentioned, with the hospitals agreement, that when they are discharged or they're released, whatever, they're given a list of resources. Well, that probably goes into the next trash can that's outside. I mean, I guess my input would be on a clinical basis. Is there something in the contract or what they're looking at that there is some follow-up by someone so that we don't have revolving door people? You know what, do you see what I'm saying? Is part of what they're saying?
Yes. So Christine, do you have any input on that question?
Yeah, I mean, the Senate Bill 2242, which is the Model Care Coordination Plan, which is the plan for outside of the hospital, we are, STAR and all of us are working extensively with the Office of the OCC, which gets the names of everybody who's in the hospital on a 5150 hold, and then reaches out to them, outreaches if they're in the community, by phone, in person, however, to try to link them with services. So yes, there is a whole group of clinicians that do 5150 follow-up that are being worked with as well.
That's great, but I just want to make sure it's written someplace that is part of the process.
Yes,
You know what I'm saying? So it doesn't get evaporated?
yeah. No, I totally hear that. Yeah, it is part of the 2242
Okay,
and hospital documentations. Yeah.
thank you.
Uh-huh.
So do we have any other contract extensions and all? Or was that it?
There's one more to cover.
Oh, okay, yes. Oh,
Okay.
that's the one that's always on the back page. All right,
The-
please.
One
Proceed.
last one. This is one I think you'll be excited about. We talked about this one last month. This is the San Francisco Community Clinic Consortium. This is the AmeriCorps program. And I don't know if you recall, but last month when we brought this through, we were thinking that it was probably going to be the last year of this because of the federal funding. So although the federal funding did get reduced slightly, the consortium, through the different groups that it's worked with, has been able to continue this program at just a slightly higher cost than we've been accustomed to paying in the past. So they'd like to go ahead and take advantage of the fact that the program is still alive and do a 3-year extension to the recently approved contract. This extension is for $1.6 million over the 3 years, about $478,000 annually. That is a 34% increase due to cuts in the funding at the federal level and a little bit of increase in cost to provide the workers for this program. This, as you recall, this program provides services to link medically underserved populations to healthcare through the Health Corps members. There's 10 members that we get that help us in our clinics and so forth in our healthcare settings to provide healthcare services to our community. Again, this is a 2142 sole source waiver contract. It's been through our legal department for review for use of that waiver, and it's funded by the general fund. So if you recall last time, we were paying about $35,000 per member for each of these 10 members to come and assist us in our clinics. This year going forward, we're going to be paying about $46,000 per member, which is still a bargain for a healthcare worker, right? So we're super excited that the program is going to continue, and that's why we want to kind of latch on and see if we can keep it for at least 3 more years of service.
Commissioners, Commissioner Rivera.
Yeah, I remember this presentation from last month and just, sort of our distress at
Yes.
hearing that it might not continue. So really, really glad to hear
Yes.
that there's been an opportunity to extend it for this contract period. So hopefully that'll
Yeah.
continue in the future. But yeah,
Yes.
it's definitely still a bargain.
Yes.
Any further questions?
No, I'll just comment though. I know it's really a very successful program. And I know of a couple of the Health Corps members after they had finished their time, went on to medical school,
That's great. Yeah.
which is great, with the focus of becoming, community physicians. So,
Right.
I mean, it's also, it's a great program to also be able to mentor, future healthcare professionals that want to be community focused.
Right.
So
Absolutely.
just a comment.
Thank you. All right. That's it. That's all I have. Thank you.
So please
Thank you.
consider a motion to recommend that the report be approved by.
All right, a motion's in order to recommend to the commission for acceptance.
I'll move approval or recommendation for approval.
Second.
All those in favor?
Aye.
Aye.
All right, thank you.
Thank you so much.
And commissioners, I'm just noting that we've got 4 contracts and then the discussion of another item, and we've got like 45 minutes, if we can keep that in mind. The item 4 is a request for approval of a new grant agreement with Glide Foundation.
Thank you for hearing this item today, Commissioners. My name is Robertson Somoa. I'm a contract manager for the Office of Overdose Prevention, Behavioral Health Services Division at DPH. We are requesting approval to fund Glide Foundation to implement the SHOP. It's a culturally relevant, low barrier, peer-led program serving older Black African-American men in San Francisco. The SHOP the request for approval of this new grant agreement with Glide Foundation is to perform culturally rooted overdose prevention, health education, intervention, and recovery services. The total proposed agreement amount is $1,120,000, which includes the 12% contingency for the duration of the contract. It's a sole source contract with only 2 years of work for this specific contract. And afterwards, the lessons that we learn from it, we will either put it out to bid or whatever the city decides. The shop draws from a trusted barbershop model to engage participants in overdose prevention, behavioral health counseling, substance use treatment, health education, and community building. And through the professional grooming services, peer connection, and therapeutic conversations, the participants will gain access to individual counseling, support groups, case management, and linkage to care, and medications for opioid use disorders. The first year, the shop is projected to serve 300 unduplicated clients and deliver over 1,700 units of service, including 900 grooming sessions, which is the haircuts to get people in, 360 one-on-one counseling and case management engagements, and 300 culturally responsive support group sessions. The funding is 100% from Opioid Settlement Fund, and the program represents a critical step in expanding the city's overdose prevention strategy by investing in community-rooted, culturally responsive interventions. And we respectfully request the Commission's approval to move this forward.
Commissioners, questions?
I know I'm being trying to be specific, but with everything that's listed here, all the different, will Glide be able to then in their reporting to you,
Yes.
be able to give you the numbers if they're, let's say, the goal is 300 clients, right?
Mhm.
How many actually, I mean, here with the counseling, resource navigation, and case management, and when you've got 5 individual client engagements a week times 2 staff, it's like, will you have the data of how many people they actually saw?
Absolutely. So with all our contracts, we have a requirement to collect data.
Right.
And we spend time with our data management team and work with them to see how best we can capture the work that they're doing at the highest level.
Okay, my concern is, I'm sure they'll see 300 people, but how many of that will actually participate in non-grooming services? That's where, I mean, I understand what you're saying,
Yeah.
you know, but that's where I'm always, you know, would
Interesting.
like to see,
Yeah.
you know, how,
So the grooming service is just one service that is
Right.
being provided. It's just to get them in. It's also
get them in the door.
get them in the door, and the setting is almost considered like a third space, because what we found is that the isolation is one of the reasons why that specific group of older African American men are dying at a significant rate. So the strategy here is we are using an organization that is deeply embedded within the Black community at a location that we are having really significant disparities, and then using that location that is already providing a number of services to
Right.
this specific community to have them be embedded in this setting that is it's a simulated barbershop setting, but we are also using an opportunity to pull people aside and have one-on-one conversations and have community events and provide food. So it's providing these specific SUD services, but we are trying to get them all interconnected with each other, rely on each other, and also be able to access these services that a lot of them fear accessing because of some of the history that they might have had with the medical, whatever the fear of it. So at the end of the day, we are going to work very closely to make sure that whatever you're doing, we are capturing it at a higher level so that we can present that data to you all.
It's great.
And I
think
believe
there's-
I'm
uh,
sorry,
go
Commissioner,
ahead.
there's someone named Lillian Mark.
Yes,
who
he's
would-
also
who
here.
would like to add, I'm sorry, to that response, if I may.
Oh, sure.
Lillian, please begin.
Or can you hear me?
Yes, just speak up a little bit.
Okay, great. Good afternoon, commissioners. I'm Lillian Mark, Chief Program Officer for Glide. Thank you for listening to this agenda item today. To share with you all, at Glide, we use Salesforce as our performance management system, and we are able to delineate the levels of care. And so currently for some of our programming, we're able to identify, you know, who came in and got a hygiene kit versus whether or not that person then also got rental assistance, and or whether or not that person also attended HIV testing or a recovery support group. So we will apply that same sort of data collection approach to this initiative as well.
Thank you. And from what I have read, not necessarily about this particular project, there are other similar projects across the country
Yes.
that have been extremely successful. So I would assume this will be too, but yeah, that was it was interesting. It was a great concept when I read about it in other, I think it was Boston or someplace back east.
Yeah, and
Great.
Any other questions? No.
Thank you.
Okay, is there public testimony?
Oh, yes, any public comment on this item in the room? And there's no one who's taking permission remotely, so please consider
Okay,
motion.
we are ready for a motion and recommendation to the commission.
I so move.
I'll second.
All those in favor?
Aye.
Aye.
All right, thank you so much. We can move on to item 5, the request for approval of a generous service agreement with Good Guard Security. Oh, I'm sorry, that's the wrong one. With Johnson Controls to perform ongoing maintenance of the building management system.
Hello, Commissioners. My name is Oleg Korsunsky. I'm the Executive Director for Facilities, Engineering, and Capital Projects at Laguna Honda Hospital. The request for approval is for a new professional service agreement with Johnson Control for the support of our building management system, in this case, Medisys. The contract will provide support for the system and its components throughout the campus. This is a continuation of existing services at Laguna Honda.
So you're saying this is a new contract and therefore it was out to bid? Somebody else was doing this before?
This is a new contract for existing services. These services were already provided by Johnson Control on site.
They were
Yes.
previously provided. Okay, so the response I got was that these were new services, so we didn't know. So you're recommending them because their work has been good?
Yes. To date,
Okay.
they've been the contractor on site since the hospital went up, and we are continuing to partner with them to provide these critical services on site.
All right. Commissioners, questions on this? I guess we had 3 contracts, but we'll start with this one.
Right.
If there are no questions, and a motion for recommendation is in order.
I'll move a recommendation for approval.
Is there a second?
Second.
All those in favor?
Aye.
Thank you so much.
Thank you.
And we can move on to the next item, which is a request for a professional service agreement with Johnson Controls to perform fire alarm suppression and pump testing.
Hello, Commissioners. Me again. This is Oleg Korsunsky. I'm here to present these on behalf of Laguna Honda Hospital. This is for the fire alarm, fire suppression and fire pump testing components of the program that Johnson Control provides at Laguna Honda Hospital. These are new contracts for existing services.
And they had been providing this before.
Yes.
So
Yes.
I should have asked this for the previous one too, but it applies in this case. So they're only 1-year contracts, but they've been doing this for many years in the past. Why are they only 1-year contracts? Or is that all it's provision for?
They've been year-to-year contracts. I've been at Laguna Honda Hospital for 14 months now. This has been my process for keeping them honest with their KPIs, their performance indicators, and I've wanted to keep them at 1 year just to make sure I'm validating their performance before we sign anything longer than that.
Great, thank you for that explanation.
Okay,
I'll move a recommendation for approval.
is that a second?
Second. Sorry. Yeah,
Yes, have the-
sorry.
All those in favor?
Aye.
Aye.
Thank you. And finally, request for approval of a new professional service agreement with Johnson Controls to perform ongoing maintenance of the P2000 security system.
Hello, Commissioners. Again, Oleg Korsunsky, representing Laguna Honda Hospital Facilities Department. This contract here is again for ongoing maintenance of our security components that are supported via Johnson Controls. These are, again, campus-wide security systems. This is everything from our CCTV to our access controls and other integrated components that provide us snapshots of our security system throughout the campus.
Yes.
How long have we had this P2000 security system? Do you know?
This is our original legacy system from when the new hospital was constructed.
So since 2010.
Yes.
Okay. Is there a need to replace or update the system at all?
We are planning that. That is going to be a phased approach that we're going to be working towards aligning our security system with what we have at Z, and also hopefully, I can't speak for our satellite clinics, but this is the path forward, which is our Linnell system. What this contract does is it maintains our existing system in place while our funding is falling into place for that eventual transition to the new system, which is the Linnell product that is used at Zuckerberg Hospital.
Do you have a sense of the timeline for the, I guess, the alignment with the ZSFG security system?
It's going to be a process for us to get that target. I would say it's a 4 to 5 year process unless we want to spend a lot of money upfront.
Okay, thank you.
Any other questions?
When it says here, the contract will provide maintenance services for security systems in place at multiple DPH locations, including Laguna Honda Hospital. What are the other?
Those
what
are
the
our,
multiple- What are the multiples?
first, I want to apologize for interrupting. Those are our other sites. Everything except for Zuckerberg Hospital is captured in this contract here. So all those sites that are not Z are part of this support contract.
Could you say some of those names to educate?
Such as the
Yeah, like
community
the
health
health center.
clinic?
Community health centers, 101 Grove, literally everything that's using the P2000 system on behalf of DPH that isn't currently at Z.
Okay, thank you.
Commissioners, motion?
So move.
Second.
Oh, all those in favor?
Aye.
Thank you so much.
Thank
And
you so
finally-
much.
We can move on to the annual fiscal year 24-25 DPH sole source waiver usage report. And would you like me to pull up the slide or just have it in case we need it?
I think if it's okay with you, that I'll just kind of present an overview and try to, and you'll have the PowerPoint as a reference and make it not maybe a little less boring. But anyway, good afternoon, commissioners. So you have a lot of materials in front of you. And I realized in like trying to assemble notes, it was probably hard to track them back in the order because it's not in the exact same order as the PowerPoint. So you have the PowerPoint. You can reference that for any of the different types of sole sources, but I'm just going to give you an overview and then if you still would like to, we can go over the PowerPoint slide, but I think this might be more efficient and more helpful, but you can tell me. But as you know, when we enter into a contract with a vendor, we have to identify the contracting authority. So typically or commonly, this includes a solicitation, an RFP, an RFQ, or a request for grant agreement is typically, but there's also many instances where we don't use a solicitation and we instead enter into what we just call in shorthand a sole source contract. So the contracting authority comes through a sole source or a legislated exemption. And we're having more of those, and I'll just talk about which is which. But a sole source typically requires an advance approval to form, and where an exemption requires the vendor, the potential vendor meet the requirements, and then there can be follow-up reporting. So I'll touch on both of these. So the first thing that you have that's, I think is labeled, is a document that looks like this, and it's attachment 2. And I would also suggest that, well, you have what's labeled as attachment 1, and that's an overview summary of how many contracts were in each type and the amount of total funding. So, so the chapter 67.24 we refer to as the Sunshine Ordinance, and what it has us do is provide a list annually to the Board of Supervisors of all the sole sources that we entered into. We give it to the clerk. There's no presentation. It's just to meet the requirement. So attachment 2 is this document. It's got one of them with the green on top. And that is all the list of the document of the types of sole sources that we're required to collect and present to the board through the clerk. So essentially all of them are based on the following criteria, and I'll touch on where they're not, but the goods and services are available from one source. Only one vendor will enter into a contract, like you went out to bid and no one else responded. Performance features that are essential to the city, or the service may be licensed or patented. So in that list, you'll see some of the categories of Chapter 21, like proprietary software license and support. You'll just see it by the categories. Chapter 21.5D is the proprietary article and only one source. Chapter 21.5B is no other source or no substitute. And then Chapter 21.5 is commodities. Commodities is something that we were asked to start including in the report. Those don't come in contracts to here. So all of these that I just mentioned go through an approval process with OCA. So the department does internal approval, and then OCA approves, allowing us to use that sole source authority. if they don't approve it, then we aren't using it. So we have to figure out another avenue, such as a solicitation. But additionally, in this packet of attachment 2, you'll see a few other sole source types that we report to the board. And over time, these have been growing, and we're just adding them to the list. Some have a totally separate criteria, but so what you'll also see in here is chapter 2142 that you keep hearing, oh, we're doing something different. That's the sole source authority that's granted to DPH, but it's the Health Commission that has the authority to approve and not OCA. So OCA accepts your commission authority, and what we've done in the past is provided a pre-approval list. And then you've approved that in advance. That meets OCA requirement, but we're changing that. So, but the purpose of Chapter 2142 of the admin code and why it was added was to address gaps between solicitations. So if, a solicitation runs out, nothing's in place, but we're not going to close down the service, this is an authority that we'll typically use. That's what it was designed for. We've also shared in the past and shared with the board, so transparently, that we have used it to start new services where there's an emergent, like it's a quick need to get it off the ground. And then we come back and do a solicitation. That is one of the areas that the city attorney is looking at. If that usage is specific enough in the language of the admin code, if we need to add it. So those are some of the questions that they're looking at. And the other piece that Kim Baker alluded to is there's criteria for the 2142, and they would like us to be more intentional so that you are acknowledging that you're approving the 2142, not just by default of approving the contract that's authorized by 2142. So the questions like, is it a nonprofit? Is it unique to the department? Does it meet the department's mission? So we're trying to figure out the simplest way to do that. But right now, until we get something in place that we can share and you can decide upon, the city attorney has allowed those criteria to be written into the Health Commission more specifically. So that will be coming back. Another way, it's actually an exemption and it's new. I can't remember now if can't do my calendar. It's from May 24. So I doubt it was in the last presentation a year ago because I don't think there would have been any contracts. But this is a change to the admin code that exempted government entities from having to go through many city processes. And so it's actually been really helpful because, when we would when we'd enter into a contract with UC, we'd have to get 5 waivers at a minimum, and they were always approved 100% of the time. So because government entities can't comply with different local jurisdiction rules and change anyway, it doesn't work for government entities to shift and have different rules for different counties. So this has been really helpful, and it has streamlined the contracting process to allow those items to be waived. There's still requirements to do our due diligence, and we could still do a bid process. It doesn't exclude us from bidding out a service that UC might apply to. So that's government to government, chapter 1.25. The next kind of recent one that you've probably heard about, actually out of order, but in February 24 is 21A.4, and we refer to that as the bed ordinance. We entered into 12 contracts in the past year. Formally in the legislation, we're required to come on January 31st to report in the prior year. So right now we're August, and we put it onto the board report just so it is done and listed. But I have to make sure, I think we'll be coming back. I think the list won't change, but to bring more information, just to make sure we've checked all the boxes of what we share about monitoring objectives and whatnot. So, but in any case, that's what it is. It's for the purpose of entering into new contracts that are residential based without conducting a solicitation. That's been really useful too, because that's a category where there's an emergent need often, and we contract with everyone that has beds. So, and many of the vendors that have beds own their building. So it isn't as if they won't be selected without their building. So we couldn't like find a new vendor to serve in their place. So that's that one that's listed. And so we included that. Yes, we may bring that back. So that's what we sent to the board for meeting the sunshine ordinance. Then there's another new exemption that you've probably heard about a lot, maybe. It's called, or in shorthand, 21B, it's core initiatives. And this was something started with Mayor Lurie, who really wanted to speed up the process wherever he could to expedite contracting for initiatives addressing core issues such as homelessness, drug overdoses, mental health needs. This has very specific reporting criteria. So what you have, it's labeled, probably confusing labeled, but labeled attachment 4, or it looks like this, and then attachment 4 may be the documents that go with it. But so for each contract that we enter into, we have to do this 1-page document that provides a lot more information. So that's all part of, there's 3 contracts. It's an attachment that says fiscal year 24-25, chapter 21B. So in fiscal year 24-25, we entered into these 3 contracts. We brought them all to the Health Commission, by the way, so they might look familiar by their names. Westside Community Mental Health, Keene Stabilization Center, the Salvation Army, and the Westside Community Mental Health Clubhouse. So, so just sharing, these are the types of reporting that we have to do. We have to alert the mayor and report quarterly. So that's that we also submitted. And then finally, the last one is chapter 21G waiver. That's attachment 3. This is actually for general fund, not just grant, even though the term is grant. You may recall we came to the Health Commission a couple years ago. We were trying to shift our professional services nonprofit contracts onto grant agreements, similar to what the other city departments do. And as part of that ordinance, it has a section that requires Health Commission approval if you're going to seek a sole source for that agreement. And so that's a waiver process that we bring to you whenever we have one that we request. It goes through Mark as your designee to sign off. And so I think, so that covers all the sole sources that we have used. And then that one summary sheet that's labeled attachment 1 just gives you an idea of new ones and then modifications to existing ones. And then the total funding. And it's not really comparing apples to apples because some sole source contracts are 2 years, 1 year, 5 years, but that's the amount of total funding when you add up the total funding over the full term for each contract.
Is there any public comment in the room on this item? Commissioners, any questions?
Commissioner?
Yeah.
Go ahead. Sure, proceed, Commissioner Giroir.
My question in a number of these allow time for solicitation. Can you, so under the sole source list, some of these that reason for the 2142 is allowing time for solicitation.
Oh, right. So that's
that?
say, I'm sorry, I cut you off. What does that mean? Or
Yeah.
Yeah. Oh, okay. So chapter 2142, unlike the rest of them, was specifically set up so that we had contracting authority. So let's say we have a outpatient solicitation and it ran out, and for whatever reason, we don't have the new solicitation completed or the new vendor selected, we have a gap. And so we don't want to end these services for 6 months or 3 months and then restart, because usually it's services. So this provides the time to go out to bid or finish the process or whatever is going on so that we can enter into a new contract that is not going to be on 2142.
So, I mean, I totally get what you're saying, but is it like the contract, this is for Edgewood, Early Childhood Mental Health Consultation Initiative. So it's allowed time for solicitation, but that contract ends in 2027. So is there like a new RFP put out, or what, how do you get that one figured out? I mean,
So for each of these, I can't speak to that one specifically because I'm not sure, but for each contract, painfully, there's a strategy that's developed, like how long. Sometimes we'll use a 2142 because we're waiting for the bigger, like we're trying to integrate, so it's going to catch up with something else. Sometimes it's another city department that provides us the solicitation authority. Not that particular title, I'm confused by that, so I won't even comment on that, but I can say that like HSA does wraparound services, and so we have contracts with Edgewood and Seneca. And so if they were delayed, for example, we might use a 2142 until they could finish it. So there's been a number of reasons, and that's part of what will be, or why we've used it. But for each one, we figure out like about how long. There's a couple categories where it's tricky, and we've used this authority. So this is one of the things we're going to look at, because it doesn't, like if you actually applied for a real grant, not a grant agreement, and maybe you applied with a CBO vendor or an expert, you know, because of their expertise, and we got it, we applied, the funder approved it, but how did we select them in the first place to apply? But now we have received funding that names the vendor, so that's a sole source. So some of those aren't going to go out to bid. But generally for every contract, we figure out a strategy, like is it when, but that's the 2142. The other ones we won't. The bed ordinance, we don't have to, the government to government.
yeah, because on this sheet here of page 4, the majority are all allow time for solicitation.
Yeah, let's see.
Michelle, could you give us an idea for Commissioner, how long it might take to get through this process of RFP?
Of
If we
RFP.
were to go out to bid for another new contract, because I think
Right.
that's what you've in the past told us, that the extensions were necessary because new RFPs
Right.
really took a long time, and
It-
to get them into operation so we don't have a lapse of services,
Right.
we have this extension of 1 to 2 years.
Right. Because that's about, it depends. Some of them are really big or lots of vendors. And so like coordinating that or changing and programming. The challenge is when something's changing or something's brand new. So it does take a while, and then it takes a while to get the new contract going. But I can give you one example. It's showing up right now as a grant agreement. But before it was a grant agreement, it was a contract. And it had gone out to bid. It's a prevention contract for substance abuse youth programming, prevention programming. It's guided by federal guidelines, and the federal guidelines that come through the state and then get feedback and comment were delayed. So when the contract ended, they didn't want to go out. They didn't want to do a RFP process internal to DPH without the federal guidelines, and then find out that we'd put together a program model that wasn't what the feds and state were going to do. And that those, I don't know if they still haven't come out, but I don't think they've come out because we're still using the waiver. So it got put off. And then we had to create then we had to create brand new contracts using 2142. And then we moved them over to the grant agreement because they met the grant agreement criteria. But so every situation is, it's a challenge. I mean, if something's straightforward, it's easy. We did a ton of solicitations in the last couple of years, but depending on the considerations, budget cuts, program changes, program model changes can impact the time that it takes to redesign, get it out to bid, select the vendors. So typically we allow about a year and a half. It's hard because the other problem is if we timed it so it ended, we'll start July 1, which seems like a reasonable amount of right, it's a new fiscal year. But if we don't get it all in place, and there's always a backlog in June and May anyway to get everything done. But if we don't get it done and their old contract ended June 30th, they won't have any money. There's nothing to pay them against. So it's a cliff. So we try to extend into the next fiscal year to allow more time. Even if the whole solicitation doesn't take a year, it won't take a year, but getting the new contract in place adds on to that.
Thank you.
Commissioner Guillermo.
Actually, Commissioner Dorado asked my question, and you answered the rest of it with your explanation. I just, it without understanding sort of that whole sort of scope of things, it does lead to a lot of otherwise questions about the timing of things. And then considering also that the monitoring reports come a year, sometimes 2 years behind the whole, grant process, solicitation process, trying to align all of that for us to feel confident about the things that we're approving or recommending for approval without understanding, the variances in, the requirements from the funding sources that we're getting versus what we're funding ourselves.
Mm-hmm.
And then the monitoring, and then just the programmatic objectives, achieving their goals and outcomes. So that's a lot of what we've been trying to understand along with you. And then now if the city attorney is going to ask for a different way to do the sole source, then that might negate some of the things that we're just coming into understanding.
Yeah.
But anyway, it's not for you to.
Yeah, we'll fold that definitely into the bigger discussion, and we'll want you'll get to decide actually, but we'll want your feedback too and recommendations on what's simple or what's confusing.
It's really different when it's like sort of a proprietary, waiver, right? So like just the one with the Johnson Controls. I mean, it's like they're not proprietary per se, but it's a pretty straightforward. It doesn't require sort of the same type of monitoring and performance report. But we're talking about primarily programmatic things, and there's so many of them, and the funding sources change also because sometimes we're going to carry that program while we're waiting. And then while we're waiting for other sources to come, and then now in the future with, just so many questions about where the federal funding is going to impact the state funding, which is going to impact us, right, in many different ways.
Yeah.
So it really helps, I think, to have sort of extended explanations about things that you're doing. And I really appreciate, that detail and also with the way that Kim is presenting the contract report as well. That really helps. Even if we hear it again and again or each time. Remember, this report is the contracting report for existing contracts versus the new one. So I think that's just really important and appreciate the complexity that you're dealing with.
Like one positive that we are, we selected a vendor and we'll be like now next steps for our, what I refer to as our electronic contract management system. And so my hope is, like, there's all kinds of hopes, but one of my main interests about it is the reporting and being able to segregate. So like, then we could say, here's this program and we have 10 more of them in a much more easier fashion, and then link like the program objective. So I think a lot of these things, hopefully, knock on wood, the intention is these will be more aligned. And so I think you'll be able to get backup data that helps put it into perspective or put it into its place more easily. Because I get it. This is hard when it's one-off, random.
Yeah, and then just not having to shuffle so much paper. I think
Totally.
there's been a great improvement over the last couple months, last presentations, but it
Yeah.
really is difficult when you're, trying to sort of align
Yes.
things,
Yeah.
and follow with the presentation and the conversation at the same time.
That's why I bagged the presentation. Like, So, all right. Well, thank you.
Well, I just wanted to commend you for this annual report that puts together all of these different reports from all the different chapters. I'm almost wondering if the Board of Supervisors knows what it's been asking for each time, which of
can ask
course
them.
was to meet a certain need. But here now they have all these reports, and hopefully somebody is reading them over there because I mean they were meant to be reviewing a transparent process
Right.
and to prevent I guess basically secret contracts. So every time they add another
I
chapter,
know.
it looks like, there's a specific need that was met. And then you wonder if the people who were concerned about that are still there. And meanwhile, we're still producing these. But I think the fact that you've actually put these all together and appreciate that when I asked for the sole source document that we have already approved, that sort of put the whole picture together, right? About first, we approved all the sole source organizations, and now here we're seeing the back end
Right.
where the contracts have come through, and you've also then put them together so that we don't get separate pieces of paper and wonder which one is which and for what purposes. So I want to thank you for really putting this presentation together. I think it's one where every year we should be reminded as to what this is. And then the details become, apparent rather than just receiving a report without this background. So
And I will thank the staff who
So
did the
thank you very
footwork.
much.
So thank you.
okay.
All right.
Next item.
Yes, emerging issues. Any public comment on this item? Any commissioner comments? No. And then there's general public comment. This is for the Finance and Planning Committee. Anyone? No public comment. So commissioners, please consider a motion to adjourn.
Motion for adjournments in order?
So move.
Second.
All those in favor?
Aye.
Thank you so much.
Thank you, everybody.